Today, we're diving into a fascinating and important topic, understanding alcohol. Our presentation, titled Understanding Alcohol from Origins to Effects, will take a comprehensive look at social drinking, its historical roots, the pharmacology behind alcohol, and the various health implications associated with it. I'm excited to guide you through this educational journey, brought to you by DSM Toolbox Incorporated. So let's get started. Here we see how ethyl alcohol naturally occurs in ripe fruits, attracting various animals and early humans alike. These early humans not only consumed the fruits, but also enjoyed the intoxicating effects of the fermented drinks made from them. This process of fermentation was more than just about pleasure. It played a crucial role in early agriculture. By turning surplus crops into alcoholic beverages, they found a way to preserve and store food effectively. This innovation likely supported the development of fixed settlements and laid the groundwork for the rise of farming communities and early civilizations. The image on the left helps us picture this natural setting where ethyl alcohol first became significant in human history. Alcohol is consumed around the world primarily for its psychoactive effects. It can induce feelings of euphoria and a general sense of well-being, which is a major reason people drink. Beyond these mood-altering effects, alcohol also plays an important role in social settings by easing interactions and helping to bring people together. We often see it acting as a social lubricant that facilitates gatherings and communication. Additionally, alcohol has been valued for its mild antibacterial properties and as a source of energy. It also holds significance in various religious ceremonies and has been used historically for certain medicinal purposes. These diverse uses and effects help explain why alcohol consumption is so widespread across different cultures and throughout history. Let's look at the historical development and evolution of alcohol use through this timeline. We begin way back in the Paleolithic era, where early fermented beverages like mead and beer were first produced, dating as far back as 9000 BC. Moving forward, ancient civilizations such as the Sumerians, Egyptians, Greeks, and Romans made alcohol a key part of their social, religious, and even nutritional practices. For instance, beer was rationed to workers, and wine was used in various rituals. Around the 8th century, a major advancement occurred with the development of distillation. This process allowed for the creation of stronger, more concentrated spirits, significantly changing how alcohol was produced and consumed. Fast forward to the early 20th century, the Prohibition era marked a time when countries like the United States implemented strict laws banning alcohol. These laws faced widespread opposition and were eventually repealed, but they left a lasting impact. Today, we see the legacy of these historical shifts in how alcohol is regulated. Modern laws control the production, distribution, and consumption of alcohol, reflecting a balance influenced by cultural norms and past experiences. This timeline gives us a clear picture of how alcohol has evolved socially and technologically over the centuries. Here we see a snapshot of alcohol consumption patterns across different regions of the world, broken down by beverage type. Globally, distilled spirits are the most consumed, making up 45% of the alcohol intake, followed by beer at 34% and wine at 12%. However, these preferences shift when we look closer at regions. For instance, in the Americas, beer dominates with 54% of consumption, while in Europe, it's also the leading choice at 40%. Understanding these regional preferences is important because it affects how alcohol is consumed culturally and socially. Another key point is the concept of a standard drink, which is crucial for interpreting these consumption levels accurately. Different countries define it differently. The World Health Organization sets it at 10 grams of pure alcohol, the US at 14 grams, and Austria even higher at 20 grams. These variations influence how we compare alcohol intake across borders and highlight the importance of context when discussing drinking habits and health guidelines. Here we see how the production of alcoholic beverages evolved over time. Winemaking really became standardized thanks to the Greeks and Romans, who refined the process and laid the groundwork for future developments. Then, around 800 AD, a major breakthrough occurred with the invention of distillation. This process allowed alcohol vapor to be collected and concentrated, resulting in much stronger spirits compared to traditional wine. These distilled spirits were often infused with herbs and spices to create unique flavors, enhancing their appeal. However, it's important to note that distillation also strips away many of the nutrients found in the original wine, such as vitamins and amino acids, leaving these spirits essentially empty in terms of nutrition. This slide highlights the shift from simple fermentation to the more complex techniques that give us today's diverse range of alcoholic beverages. Here, we distinguish between social drinking and alcohol misuse. Social drinking generally means consuming up to 2 standard drinks per day, although this can vary depending on the country. It's considered a moderate and controlled way of drinking. On the other hand, alcohol misuse includes high-risk behaviors like binge drinking and heavy drinking, as well as alcohol use disorder. This misuse is marked by negative consequences and a loss of control over drinking. Recognizing these differences is important because it helps us understand the varying risks and impacts that different drinking patterns can have on health and social well-being. Here, we have a clear picture of alcohol consumption across different regions worldwide. Globally, about 55.5% of people have used alcohol at some point in their lives, with 43% having consumed it in the past year. Europe leads with the highest lifetime alcohol use at 60%, followed closely by the Western Pacific and the Americas, both around the mid-50s. The United States shows a slightly lower lifetime use at 50%. It's important to note that these numbers don't fully capture unrecorded alcohol consumption, which makes up roughly a quarter of all intake globally, potentially underestimating the true prevalence. These regional differences and trends are crucial for understanding the broader social and health impacts of alcohol use worldwide. Alcohol is primarily absorbed in the small intestine, where it quickly enters the bloodstream and spreads throughout the body. The liver plays a central role in metabolizing alcohol through 2 key enzymes, alcohol dehydrogenase, which converts alcohol into acetaldehyde, a toxic substance, and then aldehyde dehydrogenase, which further breaks down acetaldehyde into acetic acid, a less harmful compound. It's important to note that genetic factors can significantly influence this process. For example, some people experience the alcohol flush reaction due to slower metabolism of acetaldehyde, leading to a buildup that causes redness and discomfort. These genetic differences affect how quickly alcohol is processed and, consequently, the level of intoxication and various physiological responses. Understanding this metabolism is essential because it explains why alcohol affects individuals differently and highlights the potential risks associated with its consumption. On the psychological side, social drinking at low to moderate levels typically produces feelings of relaxation and euphoria. It also leads to disinhibition, which is why people often feel more sociable or less anxious in social settings. However, when consumption reaches high levels, it can impair cognitive function significantly, sometimes causing blackouts. In extreme cases, this can result in fatal respiratory arrest, so the risks escalate quickly with higher doses. Turning to the medical complications, social drinking doesn't just affect the mind. It interacts with various diseases and medications, potentially worsening health outcomes. A large majority of drinkers, about 75%, experience hangovers, which is a common but unpleasant consequence. More seriously, alcohol can increase the risk of conditions like aspiration pneumonia and can interfere with the effectiveness of medical treatments. Understanding these effects highlights the complex impact social drinking can have, both psychologically and physically. Here, we see the effects of alcohol on 3 vital body systems: cardiovascular, immune, and gastrointestinal. Starting with the cardiovascular impact, moderate drinking might actually lower the risk of coronary heart disease. However, it's important to note that even moderate intake can cause brain volume loss in a dose-dependent manner. When it comes to binge drinking, the risks increase significantly, leading to more coronary plaque buildup and a higher chance of atrial fibrillation, which is an irregular heartbeat. Moving on to the immune system, even limited binge drinking can temporarily suppress immune function. This suppression, while mild to moderate, is particularly concerning for people with already weakened immune systems. Finally, looking at the gastrointestinal effects, high levels of alcohol increase stomach mucus production, which can cause nausea and vomiting. On top of that, alcohol impairs the vomiting reflex itself, raising the risk of aspiration pneumonia, a serious complication where vomit enters the lungs. Altogether, These points highlight how alcohol affects multiple critical systems, sometimes in ways that might not be immediately obvious but have serious long-term health implications. Alcohol might help you fall asleep faster, but it actually messes with your normal sleep cycles. This is particularly true for social drinkers or those who binge drink. One key effect is that alcohol relaxes the muscles in your throat, which can lead to more snoring and even sleep apnea episodes. These disruptions reduce the overall quality of your sleep, leaving you less rested. So, even if you don't drink heavily, it's important to be cautious and consider talking to a healthcare professional if you notice sleep problems connected to alcohol use, especially close to bedtime. Alcohol use is a major factor behind a variety of serious risks. First, it plays a significant role in accidents and trauma, including vehicle crashes, boating accidents, falls, fires, and bicycle injuries. These incidents often result in severe harm, making alcohol a critical contributor to trauma cases. Second, alcohol is closely linked to interpersonal violence. It frequently leads to loud arguments, threats, physical aggression, and is involved in many cases of homicide, assault, and child abuse. This connection highlights the broader social dangers associated with alcohol misuse. Lastly, from a legal and medical perspective, it's essential for healthcare providers to assess patients injured while under the influence for potential alcohol use disorders. Recognizing this link supports both effective treatment and prevention efforts, helping break the cycle of injury and alcohol-related harm. Here, we see how alcohol interacts with different types of medications, which is really important to understand for patient safety. First, alcohol can increase the effects of CNS depressants, such as benzodiazepines and opioids, making sedation much stronger and raising the risk of complications. It also impacts blood thinners like warfarin and nitroglycerin, which can lead to serious bleeding issues. So alcohol consumption should be strictly avoided with these drugs. On the other hand, alcohol can cause flush reactions when combined with certain antibiotics, making the patient uncomfortable or even causing harm. Additionally, it can interfere with antidepressants, increasing potential risks, and it affects how diabetes medications are metabolized, which might elevate intoxication and toxicity levels. The key takeaway is that these interactions not only reduce medication effectiveness, but can also seriously threaten patient safety. So, it's crucial to always check with healthcare providers before drinking alcohol when on any medication. Here, we focus on two key diagnostic categories related to alcohol use from the DSM-5. First, alcohol intoxication refers to the state that occurs immediately after drinking, which leads to clear changes in behavior and thinking. This means we see noticeable symptoms that are directly linked to recent alcohol consumption. The second category is unspecified alcohol-related disorders. This includes individuals who experience problems because of their drinking but do not fully meet the criteria for an alcohol use disorder diagnosis. It's important to recognize this group because they still face significant challenges related to alcohol, even if their condition isn't classified as a full disorder. These distinctions are crucial for making accurate diagnoses and planning the right treatment. Also worth noting is that hangovers might be considered a mild form of withdrawal, which underscores the biological effects alcohol has on the body. Understanding these nuances helps us better address the spectrum of alcohol-related issues. As we wrap up, let's reflect on the key themes we've covered about alcohol use. We've seen that alcohol has been part of human history for centuries, evolving from basic fermentation to more potent forms through distillation. This process, while increasing strength, has also reduced some of the nutritional benefits alcohol once provided. It's important to recognize the difference between social drinking, which many people engage in without issue, and alcohol misuse, which poses serious health risks like organ damage and cognitive problems. Understanding these distinctions is vital, not only for our personal health but also for shaping effective public policies. Remember, while alcohol has cultural and social significance, being aware of its potential harms helps us make better, informed choices.